Mechanisms of disease. Cellular adaptation and injury. Cellular adaptation is common in both disease and in normal states. The function of the cell may become enhanced or change while undergoing an adaptive response. There are different types of cellular adaptation. Atrophy is a decrease or shrinkage in cell size. It's most common in skeletal muscle, the heart, the brain, and the secondary sex organs. You've all heard the phrase, if you don't use it, you'll lose it. There are different causes of atrophy. One is a decrease in use. Again, if you don't use it, you lose it. That includes your brain, because your muscle size will shrink, but your brain cells will atrophy. They have shown with continued research with Alzheimer's that the more active you keep your brain, the more puzzles you solve or math problems you work, the less likely you are to develop Alzheimer's disease. Prolonged bed rest can cause shrinkage of your skeletal muscles. Ischemia is a decrease in blood supply. Now that decrease in blood supply stops the cells from getting the nutrients it needs, and it will lead to cell atrophy, particularly in the heart, the brain, and the kidneys. Nutrient starvation, particularly post-operatively, delays healing. And as a nurse, it's our responsibility to make sure our patients resume diets as soon as possible after surgery. Persistent cell injury, such as trauma or rhabdomyolysis, can cause problems. Now, rhabdomyolysis, you take the word apart. Rhabdo means skeletal. Myo means muscle. So rhabdomyo is skeletal muscle, and lysis is the breakdown of skeletal muscle. If you have somebody who has fallen and can't get up and lays there for hours, they're going to have skeletal muscle that starts to break down. That skeletal muscle that breaks down releases myoglobin, which is a large protein, into the vascular system, and that large protein can cause damage to the kidneys and can cause renal failure, which is one of the causes of death following rhabdomyolysis. It's also called myoglobinuria because it shows myoglobin in the urine. And we'll talk about that more when we get to the musculoskeletal system. The decrease in nervous stimulation. For example, someone who has had a stroke. If you don't move that left arm after a stroke, it will start to atrophy and can form contractures. And decreased hormonal stimulation occurs naturally as we age when we go through menopause, and ladies, and stop producing estrogen. And men also have a type of male menopause where their levels of testosterone decrease. So aging can cause it. Scurvy is a disease process that can lead to a decrease in hormonal stimulation, and scurvy is a problem with vitamin C. We don't get enough. So your symptoms of chronic ischemia in the lower extremities are that the skin becomes very, very thin, you'll have muscle wasting, and you'll have loss of hair. Now you really should have hair on your toes, everybody. I know that there are some women out there who will shave that area. But when you're assessing your patients, look at their toes, and if they don't shave them, they should have hair on their toes. If they have hair on their toes, they have good circulation to their feet. If they don't have hair on their toes, then they have chronic ischemia, and they may have peripheral vascular disease. So it's something that you need to check on. Hypertrophy is an increase in cell mass. And that increase in cell mass will also increase the size of the organ or the tissue in which it occurs. It's primarily due to an increase in the number of cellular proteins. So if you exercise a lot, that will increase your skeletal muscle mass and your strength. And then when you stop exercising, it causes a decrease in that muscle mass and that strength. Hypertension can cause the heart muscle itself to hypertrophy because it has to work so much harder against that pressure to pump the blood around. So hypertension can cause left ventricular hypertrophy and cardiomegaly, and is not a good thing. So most hypertrophy is not necessarily something that's advantageous. Although if you look at the bodybuilders out there, they have very exaggerated skeletal muscles. Some people think that's very gorgeous to look at. Your liver will also enlarge because of an increased use of drugs or other bodily toxins. For example, you may have somebody who's taking multiple medications. Well, they're all, as you remember from pharmacology, metabolized in the liver, and they are toxic to the liver over time and can cause that liver to enlarge. Or if you take non-legal drugs, that will also cause the liver to enlarge and hypertrophy. Hyperplasia means you have an increase in the number of cells. Now, usually hypertrophy and hyperplasia go together, but not always. It is usually due to an increase in demand, and it can be due to hormonal stimulation. Think about it, ladies. When you were 6 years old, you didn't have breasts. When you became 12 and your hormones kicked in, you started to develop breasts, and some of us have developed that better than others. Hyperplasia can occur due to that. Polycythemia occurs which poly means many, cy means cell, and emia means blood. So polycythemia means you have many blood cells circulating. And this occurs if you're at an increased altitude, say at the top of Pikes Peak, where there's not a lot of oxygen circulating. And so you'll have the body overproducing red blood cells in an effort to carry more oxygen around. So that would be a normal adaptation at the top of Pikes Peak. If you have somebody who has chronic lung disease, on the other hand, they have lots of dead space in their lungs because the alveoli are expanded and don't necessarily exchange gas the way it's supposed to. And in this instance, polycythemia, again, is a normal adaptation due to the fact that we don't have the capability of getting enough oxygen in, even though it's okay in the atmosphere. It's not okay within the body. And we'll talk more about polycythemia when we get to the hematologic system. Liver enlargement can occur due to alcohol abuse. Again, alcohol is a toxin to the body, and it's not something that we should indulge in indiscriminately because it can cause nasty things like cirrhosis. So liver enlargement can occur. You get calluses on your hands due to chronic friction injury. This is also a persistent cell injury that occurs, and that can cause hyperplasia, and then eventually those cells go away. Dysplasia is a disorganized appearance of the cells due to variations in size, shape, and arrangement. It is the result of a persistent injury, and it's more likely to become cancerous. Dysplasia is the result of adaptation that's gone awry. It has a disorganized appearance of the cells due to variations in size, shape, and arrangement. As I've already mentioned, it does cause a result of permanent persistent injury, and it is more likely to become cancerous. Metaplasia is the replacement of one cell type with another. This is a fully reversible process if it occurs due to injurious stimuli. When you remove that injury, that's the thing that's causing the stimulus. But if you don't remove that stimulus, it will result in persistent injury. Cellular injury results from deficiencies or excesses of essential nutrients. Your carbohydrates, your oxygen, your fats, your proteins, your vitamins, and minerals are all necessary for the body to survive. Hypoxia can be reversed if your oxygen and your blood supply are restored. And if you resume a proper diet, you can reverse the problems of malnutrition. The extent of the cellular injury depends upon the duration and the condition of the cells. The healthier the person is when they're exposed to the problem, the more likely they are to withstand the injury. There are different types. Hypoxic injury, as we've mentioned, is due to a decrease in the amount of oxygen to the cell. And that decrease in oxygen to the cell can cause ischemia. Now, ischemia, which is a decrease in the blood supply, which carries the oxygen, is better tolerated than anoxia. An means without, so this is anoxia is the total lack of oxygen. It's called strangulation when you cut off the blood supply to the brain and to the lungs by strangulating somebody and they die because of a lack of oxygen. In the absence of oxygen, only 2 ATP are produced, which causes lactic acidosis. You all remember that lovely Krebs cycle that you had to learn back in chemistry? Well, in the Krebs cycle, in the presence of oxygen, you form 6 ATP. In the absence, you only get 2. So it's like we're telling you, you still have to do the same job, but we're cutting your salary down to 1/3 of what it used to be. I don't think you'd like it. And the body doesn't like the fact that the oxygen is decreased. And so instead of using glucose for energy, they use lactic acid and you go into lactic acidosis. Chemical injury can also cause some problems. Chemical injury can be due to direct damage, like from toxic chemicals such as lye, or caustic chemical or acid. The injury occurs after the chemical is metabolized into a reactive substance because it will form what are called free radicals. Now, a free radical is an electrically uncharged atom or atom group with an unpaired electron, making it very, very highly unstable. Oxygen-free radicals will combine with water to form peroxide. Now, peroxide on the scalp or on our hair makes us nice and blonde or very white. Peroxide circulating on our tissues is not a good thing. Just think about that for a second. Acetaminophen is a chemical that in high doses is converted by the liver into a highly toxic free radical by the liver that can destroy the cell membrane of the liver, causing liver failure. And this has recently been in the news more, that maybe people are using acetaminophen because they can buy it over the counter, and it is recommended because it doesn't cause GI problems more. They're using it at higher doses than they should, and it is damaging the liver. So we may be seeing black box warnings put on acetaminophen in the next few years, or actually some concentrations taken off the market. Some chemicals will target specific cells. For example, carbon monoxide. Now, carbon monoxide has a 300 times greater affinity for hemoglobin than plain old oxygen, and so we need plain old oxygen, which is O2, to combine with our red blood cells. If you have carbon monoxide binding, that's only one oxygen molecule, and then plus the carbon, you don't have enough oxygen circulating in the body, and the person will again go into lactic acidosis. So carbon monoxide is a major problem. Lead poisoning has a very widespread effect in that it affects the kidneys, the nervous tissue, and the blood cells. That's why we no longer use lead-based paints, because children, toddlers, were chewing on their cribs and ingesting that lead, and it was causing mental retardation along with other problems. So that's why we no longer have lead-based paints. And if you are remodeling an old home, they're recommending that you get rid of that lead-based paint that is there. Alcohol, as I may have mentioned, previously, there is a genetic component to it, in that some people metabolize alcohol differently and can become chemically drunk with only one drink, one beer, where other people can drink everybody else under the table and still seem totally sober. Alcohol absorption is delayed by taking in fatty foods and or milk. I was told when I was back in college that if you were going to go out drinking, eat a pound of butter first, and that way you wouldn't get drunk no matter how much you drank. Of course, they weren't looking at the effect on your heart by eating a pound of butter, but there was a scientific basis to it. Acute alcoholism will affect the central nervous system, both your motor function and your intellectual function. Chronic alcoholism will affect your liver, your stomach, your brain, and your heart. They have shown that fetal alcohol syndrome occurs in 1 to 2 out of every 1,000 live births, and those children will have some symptoms. It's due to alcohol ingestion by the mother, as alcohol can cross the placental barrier. It causes growth retardation, developmental delays, central nervous system abnormalities, behavioral dysfunction, intellectual impairment, and the child itself actually looks different. And you can see that in a picture that is on page 74. There are intentional and unintentional injuries that can occur that can cause a problem. One is a contusion. Now, a contusion is bleeding into the skin or the underlying tissue. It's usually due to a blow that squeezes or crushes the soft tissue without breaking the skin, and it causes a bruise or a large ecchymotic area. And that bruise is due to blood vessels that rupture underneath. A hematoma is a collection of blood in a soft tissue or an enclosed space. Again, it is due usually to trauma. An abrasion is when friction removes the superficial layers of the skin. The skin will have a pale, moist, yellow-brown appearance that progresses to brown or black, and it may develop a scab. It will have a patterned appearance that may assist in identifying the causative agent. A laceration is a tear or rip in the skin or tissue, but the area itself will be kind of jagged and irregular, with the edges will be abraded, so that again, that means that the superficial tissue will be removed from there and it will look strange. An incised wound is a cut that is longer than it is deep, and a stab wound is one that is penetrating under the skin, so it's deeper than it is long. It can be caused by all sorts of different things, such as knives. Asphyxial injuries are suffocation that are due to a decrease in oxygen in the environment, or blockage of your external airways or your internal airways, compression of your chest and abdomen. Strangulation, as I've already mentioned, is due to compression and closure of your blood vessels and air passages. It's due to usually external pressure on the neck. Chemical asphyxiants, such as carbon monoxide, cyanide, cause a cherry red appearance and have a scent of bitter almonds, your cyanide particularly. Your hydrogen sulfide is sometimes called sewer gas, and with this, your blood will actually be brown tinged. You can see that the hydrogen sulfide occurs if, I don't know if you read the paper last summer, when several family members in southeastern Ohio who are Amish fell into a compost pile that they had of manure from their animals that they had, and they breathed in this hydrogen sulfide and died as a result of it. They couldn't get out of the manure in time. And so it is a very dangerous, and they worry about hydrogen sulfide when they talk about the mega farms where you have more than 300 dairy cattle or 1,000 dairy cattle in one area, and the amount of waste that they produce. It causes a problem. Drowning deaths cause cerebral hypoxia and hypoxemia as the major mechanisms of injury for that. Infectious injury is usually due to bacteria, virus, fungus, parasites. The major differences are that your bacteria are too large to enter the cells. So they work outside the cell. They produce exotoxins that get into the cell and interfere with cellular function, or they secrete destructive enzymes that digest the cell membranes and their connective tissue. Bacteria are treated with antibiotics, as you learned last semester. Viruses are small bits of genetic material that can enter into the cells, and they do not contain any DNA of their own. So they will lyse and destroy the cells from the inside, or take over the DNA and alter the DNA of the person as the person's cells, as they do with HIV. They can stay in the cells for up to 20 years or longer without causing any injury, again, as they do with HIV infection. But they can also cause major infections, such as the flu. The H1N1 virus that just came around, the swine flu epidemic that everybody's afraid is going to kill so very many people. The flu killed over 100,000 people. In fact, I may be low on that estimate. I'm not too sure about that. In World War I. And it routinely kills many, many people, the very young and the very old, every year. It's very important you get your flu vaccines. Because we cannot treat a virus with anything. We have some antivirals, but they have such nasty side effects we don't like to use them, and antibiotics are totally ineffective. We have no real idea why some viruses will destroy the cells and others just hang around doing nothing for a long, long time. Immunologic and inflammatory injury can also cause problems, and there are different types. Genetic factors, where you alter the cell nucleus and the plasma membrane structure and the membrane shape, or the transport mechanism may occur. Or you may have nutritional imbalances. For example, excess carbohydrates lead to hyperglycemia and obesity. And with insulin deficiency, glucose cannot cross the plasma membrane. That results in the person having a decrease in energy, and this can lead to type 2 diabetes, and we'll talk about that extensively when we get to the endocrine system. Physical agents include extremes of temperature such as frostbite or hyperthermia. Hypothermia or frostbite is a decrease in temperature that leads to a decrease in the blood supply, secondary to severe vasoconstriction, and increased blood viscosity, because the colder it is, blood moves slower, and that will cause ischemia and can cause some major problems there. Hyperthermic injury usually occurs after a burn, can lead to increased metabolism with the cell and can actually destroy the cell from the inside out. Pressure can cause gas emboli to form. Your atmospheric changes will alter the gas exchange with the cell, causing those gas emboli to form in the bloodstream. You notice pressure changes occurring mainly with diving injuries, such as the bends. When you talk about the bends, or you get nitrogen gas bubbles that block the circulation. Mechanical stressors are your faulty biomechanics. You go to lift something up using your back rather than your knees, and you cause a hernia to occur in your back, and some major problems that way. Ionizing radiation is your environmental radiation that alters your DNA and can cause cancer. And noise has a cumulative effect. So it's not just one exposure, it's multiple exposures. And it can cause tinnitus or tinnitus and deafness, permanent deafness. I know that this one kid has got to be permanently deaf, because ever since I was a small child, so this guy is not a small child any longer, he's probably older than I am, but I could always tell when he turned onto my road out in the country, because I'd hear his radio, and he would turn like 3 miles, 4 miles away, and I'd hear his radio, and by the time he gets in front of my house, the house is vibrating, and the sun catchers on the windows are vibrating and falling off the window. I'm sure that he's using the high pressure now to hear rather than the sound, because he's got to be permanently deaf. There are different types of cellular injury or manifestations, ways in which you see this. You'll have swelling, cellular swelling from shifts of extracellular water into the cell, failure of your ATP, or adenosine triphosphate, and your sodium-potassium pump. You'll have abnormal accumulation of your lipids and your carbohydrates. In your central nervous system, this can cause neurologic dysfunction and mental retardation. In the liver, it can cause a fatty liver that leads to cirrhosis and liver failure. Normal substances such as water and electrolytes can cause the swelling. You can also inhale or ingest heavy metals or harmful microorganisms from like insulation or coal dust from the mines. When you attempt to metabolize these substances, organs like the kidney and the liver will swell. And if you're talking about the coal dust from the mines, it permanently affects your lungs and cause black lung disease. And there's a bill in Congress that was passed to subsidize those people who develop black lung from coal mines, because they become permanently disabled. They cannot breathe appropriately without a great deal of assistance. You can have glycogen storage diseases that can cause accumulation in the loop of Henle in myocardial cells of glycogen. And in the absence of insulin, it causes diabetes. It also can cause excess glucose to be stored as glycogen. Now, if somebody ingests too much sodium, sodium will remain in the cell, pulling water with it. Now, that can be reversed. Liver failure due to alcoholism can also be reversed if the abuse stops early enough. If not, it will cause fibrosis in the liver that cannot be reversed. And as you all know, diabetes can be treated with insulin. So the ill effects of diabetes can be reversed with exogenous insulin given. Proteins are normally consist of the normally dry weight of your cells. They give your cells structure. They accumulate in the renal convoluted tubules that cause protein in the urine, or proteinuria, because they damage the basement membrane, because protein is a large molecule and normally doesn't escape into the urine. You should never normally have any protein in your urine greater than a trace. Even if you're on the Atkins diet and eating nothing but proteins, you should still have nothing more than just a trace amount of protein in your urine, because it's such a large molecule. If you have more than a trace of protein in your urine, you have damaged the basement membrane of your kidneys, and you will be going into renal failure eventually. Pigments can cause a problem. Now, pigments are produced by the body normally. Melanin is what gives our skin the lovely brown tone that occurs in the summertime when exposed to sunlight. It is considered protective, prevents us from getting skin cancer. When you don't have enough melanin, you have someone who is an albino or develops albinism. They have a pale white appearance without any color to their skin tones or their iris or their eyes. Hemoproteins are part of your hemoglobin molecule. Hemo meaning blood, so they're blood proteins. Hemosiderin are your iron stores. Bilirubin is from the breakdown of hemoglobin. It is your bile source. It's broken down in the liver and then stored in the gallbladder, your bile. And when you have too much of it, you get jaundiced. And jaundice is icteric or icterus. After the Greek person who flew with wax wings too close to the sun because his dad told him not to, he did it, and the wings melted and he fell to his death. That's why and because the sun is yellow, it's called icteric. A little bit of history there that you can confound your people at your parties. Don't need to know it for any sort of testing purpose. Calcium accumulates in dead or injured tissues. It causes dystrophic calcification, which is an abnormal calcification. If it occurs on the heart valves or cardiac valves, it will cause a murmur, which is an abnormal sound because valves should make no sound when they open. In your coronary arteries, it can cause a blockage, which can lead to an acute MI or heart attack. Metastatic calcifications or deposits in normal tissue of calcium result due to excess calcium, and this occurs because of hyperparathyroidism or an increase in the amount of vitamin D that somebody ingests. Urate is an end product, uric acid is an end product of your protein metabolism, and your urate crystals can deposit in your joints, particularly in the joints in your great toes, causing gouty arthritis, and that is extremely painful for anybody who's ever had it. And diabetics are more prone to gouty arthritis because diabetes is a problem of metabolism. Systemic manifestations of cellular injury are fatigue, malaise, and fever. Cellular death occurs normally and abnormally. Necrosis is the sum of cellular changes after the local cell death and the process of cellular self or autodigestion or autolysis. Auto means self, lysis means breakdown, breakup. A common cause is hypoxia due to severe ischemia. There are different types. Coagulative necrosis usually occurs in your kidney, your heart, and your adrenal glands. Liquefactive necrosis occurs due to ischemic injury to the nerve cells in the brain, and this is usually due to a bacterial infection. Caseous necrosis is a combination of coagulative and liquefactive, and it is usually due to the Mycobacterium tuberculosis. If you were to look at caseous necrosis on an X-ray, or if you could do it under a bronchoscope, you would see that it looks like clumped cheese enclosed by a granulomatous wall. That granulomatous wall keeps the Mycobacterium encased so it doesn't spread throughout the body. That's why people who have TB don't automatically show the symptoms right away. Fat necrosis is when calcium, magnesium, and sodium all combine to form a soap-like compound. Now, soap is really good on the outside of your skin to clean you up, but it's not really nice when it's circulating in the body. It appears white, opaque, in other words, you can't see through it, and it'll have a milky appearance, and you'll find it mainly in the breast, the pancreas, and the abdomen. Now, if you have large areas of tissue death, you'll have gangrene, and gangrene is due to hypoxia. Wet gangrene occurs in enclosed spaces, like somewhere in the abdomen. Dry gangrene occurs in open areas, such as your fingers and toes. Gas gangrene is due to an anaerobic organism, Clostridium, and this will cause death, usually due to shock. Apoptosis is an active process of cellular self-destruction or shrinkage of the cell. Apoptosis is considered normal, a normal occurrence that occurs. Somatic death is death of the entire organism. When you have somatic death, you'll have an absence of respirations, an absence of your heartbeat, and it can be reversed. You all know how, because you have to prove that you know how to do this every year. It's called CPR. If it's not reversed, the body will go through our 3 different stages, happenings. The first is ago mortis, where you'll have a decrease in temperature. The skin will actually get cold and pale. Levo mortis is where you'll have discoloration in the tissues, and this will be in the dependent areas. So if they're lying on their back, it'll be on their back, their buttocks, the back of their legs. If they're lying on their side, it'll be the side that they're lying on, because the blood will pool there, because liquid pools in the dependent areas. Rigor mortis is when you get muscle stiffness, and they used to assess the degree or the time frame that somebody had been dead by looking for rigor mortis, because it takes rigor a certain length of time to develop. It lasts for a while, and then it starts to release. So they would go by which stage that it was in. Now they're much more scientific. If you ever watch any of the CSI programs that are on television, they do liver temperature and other temperatures, because they used to, if you watch the old Perry Mason videos, they put people in freezers to delay the onset of rigor, and so that law enforcement officers could not tell the time of death appropriately, and therefore people could have alibis as necessary. But we're figuring ways to get around that as we speak. So that finishes this lecture.